So we continue our journey with the human skull, and as for now we have completed the mandible and the parietal bone. So today we start or rather study about another very simple bone, that is the frontal bone. So the frontal bone is another simple cranial bone, just like the mandible was, just like the parietal bone was. And I feel like it is one of the last few remaining simpler cranial bones which we are getting on with at the very beginning. Later things will get a little bit more complicated with the other cranial bones, but for now let's get on with the simple frontal bone, and yeah, let's get on with it. So very first thing which I always do is locating the actual bone in the human skull. So that is exactly what we are going to do here. Frontal bone is obviously frontal, so it is located in the front. Very easy to locate, very easy to visualize, just like the mandible was, just like the parietal bones were, right? So the frontal bone, it is located over here, just at the front, and as you can already see, the frontal bone is forming, you can already see this, you can appreciate it here. It is forming most of the forehead, all of the forehead in fact, right? It is forming part of the scalp as well and forehead also, right? Now we have to first discuss about the gross anatomical features of the parietal bone, obviously, and then we will be going on to the more advanced things, which is the muscle attachments and stuff. But for now, let's delve on into the anatomical features of the frontal bone. So this here is the anterior view of the frontal bone. This is the interior view of the frontal bone, right? Let's get on with the basics now. The very first thing which we can appreciate for the frontal bone is that it is a very smooth bone. We do not notice much of irregularities or processes coming out. It is very smooth, right? At least the external surface is very smooth. The internal surface, on the other hand, not so much. Internal surface has its own surface irregularities due to the underlying gyri of the frontal lobe. But we will get on with the internal surface later. For now, let's concentrate on the external surface. So the frontal bone, as far as the gross anatomical features of the frontal bone is concerned, it is divided into two parts. Listen to me very carefully. It is divided into two parts. One part is the squamous part, the squamous frontal bone. What part of the frontal bone is the squamous part? You can obviously see that here. This entire part, this entire flat, smooth part, both externally and internally. So this is also the squamous frontal bone, internally as well as externally, right? The second part of the frontal bone is, yes, see, these hollowed out depressions, big, large depressions on the inferior aspect of the frontal bone. These are the orbital part of the frontal bone. The orbital part of the frontal bone, we can very well visualize that this is forming the roof of the bony orbit of the human skull. So if I give it a very fast view, see, here it is. This is the frontal bone, obviously. This is the orbital part of the frontal bone. And as you can already appreciate from this model, it is forming the roof of the bony orbit. Obviously, there are contributions from other bones as well, but most of the roof of the bony orbit is formed by the orbital part of the frontal bone. All right. There is another part of the frontal bone. It is not indeed a part of the frontal bone like the squamous part or the orbital part, but we can appreciate when we see the frontal bone in the internal aspect from the superior view that the frontal bone has this U-shaped notch, right? It has this U-shaped notch, which is called the ethmoidal notch. The ethmoidal notch. So the ethmoidal notch is also a very prominent and important landmark of the frontal bone. And as the name suggests, obviously, the ethmoidal notch of the frontal bone will lodge the ethmoidal bone. We will talk about the ethmoidal notch later when we talk about the internal surface of the frontal bone. But for now, let's focus on the external, smooth outer surface of the squamous part of the frontal bone. Now, I would draw your attention to these regions over here. Although it is not very prominent in this model, and it will not be very prominent in the actual skull also, it is something which is to be felt. What is it? You can actually kind of see it over here. It's an elevation just above this orbit over here. So just above the orbital plate of the frontal bone, we have these bony elevations on both sides. These are what we call to be the superciliary arches. Okay, the superciliary arch, very important landmark of the frontal bone. These superciliary arches, they are more pronounced in case of the male skull, and the reason for that being the underlying frontal air sinuses. But anyways, the superciliary arch, I would like all of you to appreciate their presence over here. The other thing which I would like all of you to appreciate is these borders, the upper borders of the orbital plate of the frontal bone. You can make it out, it's very prominent, right? These borders. These borders are what we call to be the supraorbital margin. The supraorbital margins, very important and very prominent as well. You won't have any problem locating them. But what is important to remember here is this supraorbital margin, this is the lateral side and this is the medial side, right? Obviously, very obvious. So the lateral 2/3 of this supraorbital margins on both sides, obviously, the lateral 2/3 is kind of what we can call to be sharp. And you can well appreciate that fact also, right? See how sharp it is, the lateral 2/3. Whereas the medial 1/3, of the supraorbital margin is kind of rounded. It's not as prominent or sharp as the lateral 2/3. Why this information is necessary is that at the level of junction of these lateral 2/3 and medial 1/3, we have what we can call to be the supraorbital notch somewhere over here. See, the supraorbital notch, it is kind of visible over here. This supraorbital notch, why is it important to know about this? This supraorbital notch will allow the passage of what we can call to be the supraorbital nerve and vessels. So the supraorbital notch, which is present at the level of junction of lateral sharp 2/3 and medial round 1/3 of the supraorbital margins of the orbital plate of the frontal bone will allow the passage of the supraorbital nerve and vessels. Okay, so far so good, right? Now, after grasping onto the concept of supraorbital notch, we can add just one more piece of information here. Okay, you have all got up to what I have said about the supraorbital notch, right? Now just add one more information, that a little bit medial to the supraorbital notch, sometimes, or rather most of the times, the margin will allow the passage of the supratrochlear nerve and vessels. So the supraorbital notch, that will allow the passage of the supraorbital nerve and vessels. Very easy to remember because same named notch, same named nerve and vessels. But just medial to that, the margin, which margin we are talking about, by the way? Yes, obviously the supraorbital margin. Just medial to the supraorbital notch, the supraorbital margin will allow the passage of supratrochlear nerve and vessels. Kindly do me a favor and do remember this. Okay? Alright. So far, so good. Now, we were talking, or rather concentrating on the medial aspect of the orbital part. Let's see what the lateral part has to offer us. When we go to the lateral part, we encounter a very interesting thing. That thing is this process over here. Can you see it? This process is the zygomatic process. Very important and very prominent also. So you better remember it. The lateral end of the supraorbital margin, it is kind of continuing onto the zygomatic process of the frontal bone. Now, the zygomatic process, what is the function of the zygomatic process? It's not there just for show, obviously. So this zygomatic process is present due to the articulation, or rather for the articulation of the frontal bone to the zygomatic bone. Okay, so the zygomatic bone also has a frontal process. Let me show you. So as you can see, this is here the zygomatic bone. The zygomatic bone, as you can see, it is kind of, let me get this out of the way. This is throwing off a process which is articulating with the zygomatic process of the frontal bone. This process of the zygomatic bone articulating with the frontal bone is a frontal process. So let me get this straight for you guys. Frontal process of the zygomatic bone is articulating with the zygomatic process of the frontal bone. So there is a switching. Do you get that? Yes. So it's very interesting and it's very prominent also, right? And it is forming what I can kind of appreciate to be the lateral boundary of the bony orbit. Anyways, we will explore these details when we will be talking about the zygomatic bone. For now, let's concentrate on the frontal bone. So we talked about the zygomatic process of the frontal bone. Now let's concentrate a little bit laterally. So we have already moved a lot laterally, right? When we were talking about this process. Now we are kind of moving to the posterior direction. Let me give you a better view. See, can you make out the zygomatic process here? Yes, of course you can. See, the zygomatic process, the posterior margin of the zygomatic process, which is kind of this, right? This here, it is continuing above as a line and then splitting into these two lines. Can you make it out? I hope you can. See, this is the posterior boundary of the zygomatic process. The zygomatic process is over here. Can you make it out? This is the orbital part. Okay, this is the squamous part of the frontal bone. This entire thing is the squamous part of the frontal bone, but this is the anterior part of the squamous part of the frontal bone. This is the zygomatic process, and the posterior margin of the zygomatic process of the frontal bone, it is kind of continuing here as a line and then splitting up into this line over here and this line over here, right? This line is called the temporal line. The temporal line. And it is splitting up into what we call to be the superior and inferior temporal lines. Now, we have already encountered the superior and inferior temporal lines when we were talking about the parietal bone. So the commencement of the superior and inferior temporal lines, now their origins is kind of clear to us, that it is originating from the posterior margin of the, what is this? Yes, very good. The zygomatic process of the frontal bone. And then continuing, or rather demarcating, or rather splitting up into the superior and inferior temporal lines. Now, as far as the importance of these lines are concerned, the superior temporal line is providing attachment to what we can call to be the temporal fascia. Okay, so the superior temporal line, this is actually providing attachment to the temporal fascia, whereas the inferior temporal line is providing attachment to the temporalis muscle. Very important. So the superior one is giving rise to fascia, inferior one is providing attachment to the temporalis muscle. So you may get confused. Was the superior one providing attachment to the muscle, or was it the inferior one? So for this, getting things out of way, what I would recommend you to remember is that, see, fascia, it stands, or rather it starts with F. Fascia starts with F, and muscle stands with M, right? F comes before M. F comes before M alphabetically. So fascia's attachment is kind of superior. It is coming above, before. Am I making any sense? They're kind of similar, these words, before, above. You can kind of correlate these things. Okay, so that is why fascia's attachment is superior to muscle's attachment. So temporal fascia, temporalis muscle. Also, there is another thing, that is the inferior temporal line. It is also acting as what we can call to be a boundary, an upper demarcation to what we call to be the temporal fossa, not temporal fascia. I'm talking about temporal fossa. Okay, so the upper demarcation is by the inferior temporal line. So that being said, now let's again move back to the front view. We were talking about the squamous part, right? But there is a very interesting characteristic of the surface of the frontal bone over here, right? You can make it out, very easy to make it out. See, it is kind of serrated, this boundary. This part of the frontal bone is the nasal part of the frontal bone. Very, very important. This is the nasal part of the frontal bone. And it's pretty self-explanatory, because this part of the frontal bone is going to articulate with, yes, the nasal bones and will form a part of the nasal septum. This is the boundary or part of the frontal bone which we were talking about. That is the nasal part of the frontal bone. These over here, the two bones, these are the two nasal bones. So very truly we can see that they are articulating with the frontal bone at the nasal part of the frontal bone. But the information is incomplete. The nasal bones are articulating with the nasal part of the frontal bone, but they are not the only bones which are articulating with the frontal bone at the border. Right? There are other bones also which are articulating with the frontal bone along the nasal notch, or rather the nasal part of the frontal bone. What are those other bones? See, let's start from the medial aspect and proceed laterally. This over here is a nasal bone. This bone, this is the maxillary bone. Yes, and this is the frontal process of the maxillary bone. So this is the nasal bone, this is the maxillary bone or the maxilla, and a little bit more medially, this over here is the lacrimal bone. Yes, so the lacrimal bone is the most lateral attachment to the nasal boundary or the nasal part of the frontal bone. Okay, so from medial to lateral, the attachments are nasal bone, maxilla, and the lacrimal bone. Pretty easy, right? Right. Now that we have the anatomical skull with us, let's get on with one more thing. Very clearly, you can demarcate that this is a suture, right? This is a suture between the two nasal bones, right? The right one over here and the left one over here. So the suture between the two nasal bones, what can they be called? Of course, the internasal suture, right? Having known about the internasal suture, now look at this suture over here. Can you make it out? Is it too magnified? See, this suture, this is between the nasal part of the frontal bone or the nasal notch of the frontal bone. This is also called the nasal notch of the frontal bone and the nasal bone. So this suture, this is known as the frontonasal suture. The frontonasal suture. The point where the frontonasal suture is meeting the internasal suture, this point over here, this is called nasion. Okay, this is called the nasion. Right, done. Now let's again isolate the frontal bone and talk about it individually. Here in the model, what has been kind of left out is a little bit has been left out, yeah. So we will try to make that up. Okay. What is missing in this model is the triangular nasal spine. Listen to me very closely. See, this over here, what did I say this was? Yes, this is the nasal notch of the frontal bone. A little bit posterior to the nasal notch, I'm going into the inner aspect to get a better view. Somewhere over here, this is the posterior aspect of the nasal notch, right? Are you able to visualize? This is the anterior aspect. This over here is a nasal notch. Now I am saying that behind the nasal notch, on its posterior aspect, which will be somewhere over here, right? So what is present over there is a triangular nasal spine, a triangular bony projection from the nasal notch, which is known as the nasal spine, right? Now, I just showed you the articulation of the nasal bones with the frontal bone. Actually, if we are to be a little bit more precise about that articulation, we would have to say that the nasal bones, the two nasal bones, the posterior sharp borders of the two nasal bones is in fact articulated with the front of the nasal spine. So we just overcompensated by saying that the nasal bones are articulated with the nasal notch of the frontal bone. But if we are to be a little bit more precise about that articulation, what I am telling you to embed in your minds is that there is a triangular nasal spine in the posterior aspect of the nasal notch, right? That nasal spine will actually articulate with the posterior sharp border of the nasal bones. So this over here is the what we can call to be the nasal bones. Both of them are present over here. This is the internasal suture, and this nasal bone, if we are to see it posteriorly, then this nasal bones together, they have a sharp boundary over here. That sharp boundary, along that sharp boundary, they are articulated to the triangular nasal spine of the frontal bone, which is located where? Yes, behind the nasal notch. Now, having talked about the nasal bones and their articulation to the frontal bone, let's talk about one more bone and its articulation to the frontal bone. That bone also, although we will be talking about the articulation of that bone when we will be talking about the ethmoidal notch, but something which is related to the nasal notch over here and that bone is that, obviously you can make out that I'm talking about the ethmoid bone and its articulation to the frontal bone, right? You can make that out. Obviously I'm talking about ethmoidal notch. What bone other than the ethmoidal bone can articulate with the frontal bone along the ethmoidal notch? Obviously. Anyways, so the ethmoidal bone, when we will study about it individually, we will know about the details of that. But for now, you just know that the ethmoidal bone has what we can call to be a perpendicular plate. Okay, what you are seeing right now is the frontal bone with the ethmoidal bone articulated over here. What I would like all of you to appreciate is how that articulation is taking place. We will come to know when we are talking about the interior, but let's get on with it. See, do you see this plate over here projecting outwards? Can you see it? That plate is what we call to be the perpendicular plate of the ethmoidal bone. Okay, that is the perpendicular plate of the ethmoidal bone. Okay, so this perpendicular plate of the ethmoidal bone, this over here, it actually is projecting upwards superiorly, and if we are to see it carefully, the problem here is that the triangular nasal spine is not that demarcated. Otherwise I could have shown you that the perpendicular plate of the ethmoid bone is lying just below the nasal spine. So that is something I would have shown you, but you can well appreciate that from this model also, kind of, right? Okay, so that is about the nasal notch of the frontal bone. Now, I had talked about the superciliary arches, right? The bony elevations, I had talked about them. The imaginary meeting point of these superciliary arches somewhere over here, that is called the glabella. Okay, so that point is called the glabella. In surface anatomy, glabella is actually the point between the two eyebrows. It is not a point actually, it is an area. It is an area between the two eyebrows, right? So pretty simple to find out. Anatomically speaking, it is the imaginary meeting point of the two superciliary arches. And we have already talked about the superciliary arches, right? Now, just like parietal bone had parietal tuber, which was the widest convexity on the parietal bone, the frontal bone also has frontal tubers over here on two sides, okay, laterally on two sides, where the convexities of the squamous part is the maximum. So that is the frontal tuber. It is actually not about convexity, it's about elevation. So I may be wrong in telling that they are maximum convex sides of the frontal bone. Maybe it's not like that. It's more like they are elevations on the squamous part of the frontal bone, which are called the frontal eminences or the frontal tuber. This frontal tuber is interestingly more demarcated in females and children. Okay, it is more demarcated in females and children. So just like the superciliary arches were more demarcated in the males, frontal tuber, in case of the frontal tuber, women and children, they get the chance, right? So in them, this frontal tuber is more pronounced. But that is not the end of information about the frontal tuber. There is another very important information associated with the frontal tuber. That is, the frontal tubers are the site of commencement of ossification of the frontal bone. See, this is something very common. The tubers or the eminences are naturally or commonly they are the sites of commencement of ossification, just like we have seen in the parietal bone as well, right? So just like that, the frontal tuber is also the site of commencement of the ossification of the frontal bone. So what lies above these area? That is also something we have to learn. Although we will be learning about what lies above this area, what nerves are there, what vessels are there, what is being supplied, what is the stuff all going on, we will be talking about that when we will be talking about the scalp. But for now, we should know that the frontal tubers on both sides, they are covered by the frontalis muscle. The frontalis muscle. When we will be talking about the scalp, we will be talking about the frontalis muscle as well, and how it is being attached to the, or rather inserted into the epicranial aponeurosis. We will get into that later. But the frontalis muscle, for now you know that it is a muscle and it is covering the frontal tubers, and obviously on both sides. On the other hand, the area between, which is not being covered by the frontalis, that is being covered by just what I had said just a little bit ago, the epicranial aponeurosis. So in between the frontalis muscles, we have the epicranial aponeurosis or gallia aponeurotica. Okay, again, there is nothing to panic about. We are not going to discuss about for this discussion. They are things which will have their own novelty. We will talk about these when we will talk about the scalp, temple and face. Now, having said all of this, let's talk about the posterior, what we can say here to be the margin or border of the parietal, the frontal bone. Okay, so this is called the posterior or the parietal border or boundary of the frontal bone. Why? Obviously because along this margin or along this border, the frontal bone is articulated to the anterior border of the parietal bone. So let me repeat it again. This border which is the posterior border or posterior boundary or posterior margin of the frontal bone, this is articulating with the anterior border of the parietal bone, and they are forming what we call to be the coronal suture. So very evident that this is the suture along which the frontal bone is articulated to the two parietal bones, and this is the bregma, which we have already talked about, right? It is the point of meeting of the coronal suture over here with the sagittal suture over here, right? Having got the posterior boundary out of our way of discussion, now we are free to discuss about a little bit of this triangular margin or triangular area over here. Do you see it? It's very clearly demarcated, right? This triangular area of the frontal bone, this is also a part of articulation of the frontal bone, but not to the parietal bone. Okay, so the parietal bone is obviously more superior over here. It is only limited up to the posterior boundary, which is somewhat over here, right? This boundary, this is where the articulation of the parietal bone is taking place, but the parietal bone's articulation is not taking place up to this right here, right? So what bone is articulated to this triangular area of the frontal bone? The answer to this is the sphenoid bone is articulated to this area. Let's see how. See, in the norma lateralis, which is the lateral view of the skull, we can make out that this is the frontal bone, right? And this over here, this is the sphenoid bone. So if we are to see the articulation of these two bones, we would appreciate that this is along this boundary over here, right? This boundary over here. So let's see how internally this looks. Okay, so this is how, if we have removed the other bones, this is how it will look, the articulation. This is the sphenoid bone, obviously. We will talk about it later in a future video, obviously. So what I was talking about is that the triangular area, so this over here, this is the triangular area which we were talking about of the frontal bone. Now just I have said this is articulated to the sphenoid bone, right? Now, although we do not really know yet about the different parts of the sphenoid bone, but it does not hurt to know that, look very carefully. This over here, do you see this? This is the greater wing. I talked a little bit about this, I remember, when we were talking about the parietal bone. We will talk about this later, obviously, when we discuss the sphenoid bone individually. So this is the greater wing of the sphenoid bone, okay? The greater wing. Whereas this horizontal one is the lesser wing. The horizontal bony elevation, the horizontal bony projection, this is the lesser wing, right? So can you appreciate as to which part of the sphenoid bone is articulating with this triangular area? It is this part over here, right? So it is actually articulated to the greater wing of the sphenoid bone. Okay, so this triangular area, see, it is adjacent to this, that is a greater wing of the sphenoid bone. Okay, more details will obviously be covered when we talk about the sphenoid bone individually. Having talked about the different articulations, let's talk about the internal surface of the frontal bone. Okay, so this over here is the internal surface of the frontal bone, and the thing is, it's not very visible here again, but as I have already said to you, that the internal surface of the frontal bone is not as smooth as the external surface of the frontal bone was, and obviously it is filled with surface irregularities due to the underlying gyri and sulci of the frontal lobe, right? Also, you can kind of make out over here there are some lines, right? Very faint. These are what we call to be the vascular markings due to the underlying meningeal vessels. Okay, right. The most prominent thing which we notice in the internal surface of the frontal bone is this midline structure. This midline elevation, this midline crest, this is what we call to be the frontal crest. Okay, so it is called the frontal crest. Now, this frontal crest, it's actually a sharp crest, and although it's not very clearly given here, as clear it would be in an actual human skull, but this frontal crest actually has these two boundaries. Okay, the two boundaries of the frontal crest, its margin, actually not boundary, margin, the margin of the frontal crest is actually providing attachment to falx cerebri. Falx cerebri, we will talk about it when we talk about the neuroanatomy and the foldings of the dura mater. So it is actually a folding of the dura mater, which we will talk about it later. So the margin of the frontal crest is actually providing attachment to the falx cerebri. Also, see what's happening is that the frontal crest, it is actually emerging out and moving upwards, but later it is actually splitting up and its boundaries are becoming more distinct. So due to the splitting up, a kind of a some space is being created, right? So within that there is what we call to be the lodging of superior sagittal sinus. So the superior sagittal sinus is also related to the frontal crest. The boundary, the margin of the frontal crest is providing attachment to the falx cerebri, right? And also lodging the superior sagittal sinus. Okay. The superior sagittal sinus is itself lodged within the what we call to be sagittal sulcus. Okay. We had talked about this when we were talking about the parietal bone as well, right? About the sagittal sulcus. So it is somewhat coming from above to downwards. That is why the frontal crest, which is a midline structure, that is actually associated with the superior sagittal sinus. Okay, done. Now this over here, this margin of the U-shaped ethmoidal notch, this is providing attachment to the superior surface of the labyrinth of ethmoid bone. I hope it's not getting very overwhelming here, because it might. See, what's happening is that, again, this is related to the anatomy of the ethmoidal bone. But still, let me give you a very short and very small overview. Not an overview, I will just talk about one or two things about the ethmoidal bone so that you understand this. See, what's happening is that this is the ethmoidal bone and this is the superior aspect of the ethmoidal bone. Now you can demarcate this area, right? This area which is filled with perforations and holes. This is what we call to be the cribriform plate of the ethmoid bone. Okay, and As I have already mentioned, this over here is the perpendicular plate. Let me give you a better view. The lateral view reveals the perpendicular plate. And we have talked about how the perpendicular plate is, kind of just below the nasal spine. We have talked about it. This over here is a perpendicular plate. So this over here is the cribriform plate of the ethmoid bone. And what I would like you all to appreciate is these lateral bony cavities of the ethmoidal bone. They are what we call to be the bony labyrinth. Okay, so the bony labyrinth of the ethmoidal bone are the lateral cavities or projections, not projections, but the lateral masses on either side of the cribriform plate of ethmoid bone. So now we have just a basic idea of this cribriform plate, this lateral labyrinth, the perpendicular plate, and just one more thing you just try to grasp this. It is that, do you see this elevation over here, this elevated ridge? This is what we call to be the crista galli. The crista galli. So this bony elevation is also associated with the ethmoid bone. Now whatever I talked about the ethmoid bone, this will come in handy when we will be talking about the articulation of the ethmoid bone to the frontal bone. So let's get on with it then. So now, just as I had said that when we will be talking about the internal surface, we will come back to the ethmoidal notch. So the U-shaped ethmoidal notch is actually lodging the which part of the ethmoidal bone? What did I say just now? Yes, the cribriform plate of the ethmoidal bone. So if it is lodging the cribriform plate, with what is the articulation taking place? Actually, the articulation is with the superior surface of the labyrinth of the ethmoid bone. So the articulation of the medial margin of the U-shaped ethmoidal notch is with the superior surface of the bony labyrinth on both sides over here. The superior surface of the bony labyrinths of the ethmoidal bone. With them that articulation is taking place, and as a result of that articulation, the upward projecting crista galli, you can make it out, along with the cribriform plate, they lie over here. What is completely missing from this model is that you see the crista galli anteriorly, it is not flattened out like this. This is completely wrong. What happens is the crista galli has two ala. Okay, the crista galli has two ala, two diverse or two divergifications over here. Two small ala, two small processes kind of, which form a V-shaped structure. These ala of the ethmoidal bone, they will kind of come in contact with the corresponding part of the ethmoidal notch of the frontal bone, and together over here, somewhere over here, they will form a opening. They will form an opening. That opening is called foramen cecum. Foramen cecum. So the foramen cecum is formed somewhere over here due to the what we can call to be articulation of the ala of crista galli with the ethmoidal notch of the frontal bone, forming the foramen cecum. And this foramen, I have always said that almost all foramina present in the cranial bones, they are present due to the passage of some structures, right? So foramen cecum is not a very important foramen, because of the reason that sometimes, a lot of times, no structure passes through the foramen cecum, right? But sometimes what may pass through the foramen cecum is emissary veins, right? So emissary veins may pass through the foramen cecum, and emissary veins are obviously connecting veins. They connect the internal venous sinuses with the external venous supply. So in this case, the emissary veins will connect the superior sagittal sinus with the veins outside, most probably the mucosal veins outside. Anyways, it's not that important. But it is important to know that a foramen is being formed and how interesting its formation is. Now, we were talking about the internal surface of the frontal bone. We have talked about the squamous part of the internal surface of the frontal bone. Let's talk about the internal part, and this is perhaps the last part of the frontal bone. The internal part of the orbital surface or the orbital plate, somewhere over here, of the frontal bone. So let's see where the orbital plates were. Yes, see over here. So the corresponding internal surface will be over here. Right? Right. Now, the interesting thing is that the internal aspect of these orbital plates, they are known as the cerebral surface. The cerebral surface of the orbital plate. So the orbital plate, it has two surfaces, right? One is the external surface, which is actually called the orbital surface because it is forming a part of the bony orbit. And an internal surface, which is related to the cerebrum, right? This is the brain cavity. So that is why it is called the cerebral surface. Now, these are the two surfaces of the orbital plate. Now it also has three margins, which we have to appreciate, right? What are the three margins? We have kind of talked about them. The medial margin, somewhere over here. Right? The medial margin, the lateral margin, the medial margin over here, and the posterior margin. Right? So the orbital plates, they have the medial margin, the lateral margin, and the posterior margins. I had talked about the bony orbital plate, but I had missed out a point. My apologies for that. Over here, anterolaterally, in the orbital region of the frontal bone, anterolaterally, somewhere over here, there is a depression. Okay, there is a depression. That depression is actually called the lacrimal fossa. The lacrimal fossa. So the lacrimal fossa, it's obviously meant for lodging the lacrimal gland, or more precisely the orbital part of the lacrimal gland, right? So the lacrimal fossa is present anterolaterally in the bony orbital plate of the frontal bone. Also, anteromedially there is another depression. It is not very prominent over here. Anteromedially there is another depression, and it actually gives attachment to what we call to be a fibrocartilaginous pulley. A fibrocartilaginous pulley through which the tendon of superior oblique muscles of the eyeball will acutely change direction. Overwhelming, it might seem. Actually, this requires a bit of pre-knowledge about the eyeball and the muscles related to the eyeball movements. Those are obviously for future discussions. So there is this muscle, which is the superior oblique muscle. of the eyeball, and the tendon of that muscle that will pass through a fibrocartilaginous pulley which is attached to the anteromedial aspect of the bony orbit of the frontal bone. Okay. Now a pulley, it's a pulley, so the tendon, when it will pass, it will change its direction acutely, right? Talking about the cerebral surface, we were already talking about it. We talked about the ethmoidal notch, right? The posterior margin of the cerebral surface of the orbital part of the frontal bone, just one information I had skipped, and that information is that this posterior margin, I had said, right, that the orbital plate, it has those three boundaries, those three margins, the medial one, the lateral one, and the posterior one. So the posterior one, it is actually articulated to the sphenoid, because you see, just posterior to the frontal bone, there will be the sphenoid over here, somewhere over here, right? The body of the sphenoid will be in the middle, and the lesser wing will be like this, horizontally, whereas the greater wing will articulate with the triangular regions right over here. So we can kind of appreciate it from over here, right? See, this is the frontal bone. Obviously we are seeing it superiorly, and the internal aspect. This over here is the posterior margin of the orbital part, or the cerebral part of the orbital surface of the frontal bone. So what is it articulating with? This bone over here. This bone is the bat-shaped sphenoid bone. But more precisely, what is this over here, which is articulating with the posterior margin? What is this surface, or what is the structure of the sphenoid bone? We have kind of talked about it. This is the horizontal lesser wing. Yes, very good. The horizontal lesser wing. This over here is a greater wing, and this horizontal structure is a lesser wing. So the lesser wing is actually articulating with the posterior margin of the cerebral surface of the, you see, orbital frontal bone, right? So if we do just a last quick revision of the fate of the orbital plate, we can find that the posterior one is articulating with the lesser wing of sphenoid, right? The medial one is over here, right? See, yes. So the medial one, the medial margin, is kind of articulating, or not articulating, it is forming the boundary of the ethmoidal notch. Too easy, right? Whereas the lateral margin, it is forming, if we move over here, yes. So the lateral margin over here, see, it is forming the anterior margin of the triangular area which I had talked about, right? The lateral margin is actually forming the anterior border of the triangular area, and this part was connected to which bone? The sphenoid bone. Which part of the sphenoid bone? Yes, very good, the greater wing of the sphenoid bone. Whereas the posterior one was, the posterior margin of the cerebral surface of the orbital part of the frontal bone was articulated with which part of the sphenoid bone? Yes, the lesser wing of the sphenoid bone, right? So with that, I think we have done enough justice to the frontal bone and the discussion regarding it. Again, this was an easy bone with not much information to provide about it, and not much structures related to it. I think we have sufficed for the frontal bone. This is sufficient. And again, thank you very much for watching. Thank you again.